Welcome to MH Health. In today's video, we learn what an echogenic bowel is, the possible causes, and how they can be identified. The information provided in this video is sourced from the National Health Service, NHS, ensuring accuracy and reliability. A baby is said to have an echogenic bowel when their bowel appears brighter than usual on an ultrasound scan. It is sometimes referred to as bright bowel. Echogenic bowel is usually identified during the 20-week anomaly scan, although it may be noticed during an earlier scan or in a growth scan later in the pregnancy. What are the possible causes? Echogenic bowel is seen in less than 1%, 1 in every 100 pregnancies, and in over 90% of cases, 90 in every 100, 100%, it is a variation of normal. It often resolves itself during pregnancy. The baby does not have any health problems, and no cause for the echogenic bowel is found. However, there are some known causes of echogenic bowel. These include bleeding during early pregnancy. Sometimes bleeding occurs during early pregnancy, which you may or may not have been aware of. Echogenic bowel can be caused by the baby swallowing some of the blood in the amniotic fluid. This is not harmful to the baby. Cystic fibrosis. Echogenic bowel can be associated with cystic fibrosis, CF. This is an inherited genetic condition that affects the lungs and digestive system after birth. It is found in around 2% of babies, 2 in 100, with echogenic bowel. A baby can only be affected by cystic fibrosis if both parents are carriers of the cystic fibrosis gene. Infection. Echogenic bowel can be associated with infections that have crossed the placenta. An example is cytomegalovirus, CMV. This accounts for up to 2% of cases, 2 in every 100, of echogenic bowel. Chromosomal difference up to 3%, 3 in every 100. Babies with echogenic bowel also have a chromosomal difference. The most common chromosomal difference associated with echogenic bowel is Down's syndrome, trisomy 21. But there are other chromosomal differences associated with echogenic bowel too. Bowel obstruction. A bowel obstruction, damage to the bowel from twisting or reduced blood supply, is identified as the cause of an echogenic bowel for 1% of babies, 1 in 100. A bowel obstruction may not be detected until later in pregnancy. Placental function. Some babies with an echogenic bowel have reduced blood flow through their placenta. If the blood flow through the placenta is reduced, it will not provide the baby with enough oxygen or nutrients. This may affect the baby's growth or cause the baby to be smaller than expected. Tests suggested to detect echogenic bowel. Cystic fibrosis, CF, screening. You and your partner will be offered a blood test to find out if either of you carry an affected gene. A blood test to identify possible infections. We will offer you a blood test to find out if you have been exposed to an infection. Sometimes the symptoms are very mild, and you may not have realized you had an infection. Diagnostic tests, chorionic villus sampling, CVS, or amniocentesis. These tests examine your baby's chromosomes in detail and are used to determine whether or not your baby has a genetic or chromosomal difference. They can also be used to find out if your baby has an infection. Ultrasound scans. You will be offered an ultrasound scan at 28 and 34 weeks to assess your baby's bowel and overall growth and well-being. If you find this video helpful, hit like, subscribe, and bell icon